A very good day, Ms. Shaza. Today I will be presenting my behavior modification project focused on weight management for PCOS. I'm Kesavartini Satyasilan. So, for the introduction to the behavior and goals, the behavior I targeted was weight management due to PCOS, a hormonal disorder that often leads to weight gain and insulin resistance. My main goals for this project were to lose 4 kg in 4 weeks, manage emotional eating, and improve my sleep patterns by getting at least 7 hours of sleep per night. Why I choose weight management is my target behavior. Because for me, PCOS is hormonal condition that impacts ovarian function and has been associated with weight loss. And also, weight loss is benefit for health. A 5 to 10% weight loss can help with PCOS symptoms. For example, establishing regular menstrual cycle, increasing the rate of conception, lowering acne and excessive hair growth. And also, emotional impact with PCOS can result in anxiety, low self-esteem, emotional eating, and lack of the desired workout. Not only that, the insulin resistance increases the blood sugar levels and causes a development of fat and the abdomen. And also, it making weight management is more difficult. So these are the reasons I choose the weight management is my target behavior. This is really important to me. So this slide is focused on SMART goals overview. To achieve effective weight management for my PCOS, I follow the SMART goals framework. This helped me to stay organized and ensure each goal was well defined and trackable. Specific primary goal was to lose within a set period of time, and also I focus specifically on weight management because of its direct impact on my PCOS, particularly in reducing insulin resistance and improving overall health. And also I measure my progress by weighing myself weekly using a scale. And also this is give me concentrate data to see if I was on my track to meet my target. Achievable. Achievable is I set a goal that was realistic within the reach based on my past experiences with weight loss. And also I aiming to lose 1 kg per week over the 4 weeks was challenging, but it's achievable in the end. 11 is the goal was directly related to managing my PCOS symptoms. Losing weight helped reduce the symptoms like insulin resistance, and this was an important factor in my motivation to achieve it. So the last one is time bound. Time bound, I gave myself a clear time frame, which means 4 weeks to achieve this goal. To start date 5th August 2024 until 2nd September 2024. This kept me focused on making consistent progress each week. By setting the SMART goal, I was able to stay focused and monitor my progress throughout the intervention. SMART goal is really helped me to achieve my target behavior. So this slide is explain overview of the intervention plan through my 4 weeks of my therapy section. In week 1, I focus on reducing stress, managing weight and improve sleep. For example, I started tracking my sleep using a sleep tracker, and I noticed I was only getting about 5 hours of sleeping each night, which made me feel more stressed. To improve this, I practiced a relaxation technique before bed like deep breathing and progressive muscle relaxation. This helped me improve my sleep quality, and after a week, I was sleeping 7 hours. In week 2, I began to examine my unhealthy behaviors, especially my diet and lack of regular exercise. And also, I noticed that whenever I feel stressed, I turn to sugary snacks. To change this, I set a target to cut down on my sugar and replace it with brown sugar or healthier options like fruits, like that. And also, I created a basic workout, which means included a 30 minutes of walking every day. By the end of the week 2, I was able to stay consistent with my exercise and started noticing improvements in my mood and energy levels. In week 3, emphasized the exercise and managing my emotional eating. I started using a food and mood tracker, which helped me to recognize emotional triggers, especially when I feel was overwhelmed with my assignments. For example, I realized that I tend to overeat when I feel anxious, so I started practice mindfulness before eating. For example, pausing to ask myself if I really hungry or just stressed, like that. This helped me to reduce my emotional eating significantly. As a reward for sticking to my fitness routine and avoiding emotional eating, I treated myself to go a movie, buy a new book, or just rewarded for me a Watson things, like that is keeping me to be motivated to achieve my goal. And also in the final week 4, I evaluated my progress. Like I found that my stress level had decreased and I had lost a 5 kg over the 4 week, which I felt like a major success for me. And also I continued using technique like progressive muscle relaxation and visualization whenever I felt stress. These methods were very helpful in managing my stress, especially when preparing for exams. Overall, using a mindfulness technique and tracking my food and emotion allow me to better understand my triggers and my healthier choices. This plan not only helped me to manage my weight but also improve my overall well-being by reducing stress. I'm using some techniques techniques to implement it for my behavior change. So now I'm going to explain to you what are the techniques that are implemented for my behavior. To ensure the lasting change in my behavior, I apply a variety of techniques that are commonly used in behavior modification. So the first one is the using positive reinforcement. The positive reinforcement is to strengthen good behavior by adding something enjoyable. For example, when I was successfully follow my meal plan or completed my workouts, I would reward myself with small yet meaningful like a healthy snacks or extra time to relax like that. These rewards were not just about the food. They helped me to feel accomplished, which is turn motivated me to keep going. Over time, these rewards are strengthened my health habits too. And also I'm applying negative reinforcement. In contrast, the positive and negative reinforcement is about removing something undesirable. For my project, I focus on improving my sleep routine, by identifying things that contributed to poor sleep like staying up too late or taking naps at odd time. By eliminating these habits, I noticed that my overall quality of sleep improved. So the removal of those unhealthy sleep habits serve as my negative reinforcement. So I'm also applying a punishment for missed goals. For example, the bad habits, I set a consequences for myself whenever I skip a workout or didn't follow through the meal plan. One of these punishment was limiting my social media usage, which means something I usually enjoy. So the consequences to my behavior, it helped me to stay more disciplined. By the way, the punishment is not always the first choice in behavior modification, but it is useful something to keep me responsible for my goals. So the next is extinction to manage emotional eating. Extinction is I'm using for a biggest challenge such as the emotional eating, because the emotional eating is really I cannot control the emotional eating. Over the stress, I'm going to eat it. Over the assignment overload, I'm going to eat. So this extinction is really helped me to involve removing the triggers that causes unwanted behavior. Through the mindfulness and relaxation exercise, I identify situations that would typically lead to emotional eating like feeling stress or overwhelmed. By addressing this emotion through the outlets like deep breathing or meditation, I was able to reduce the occurrence of emotional eating. So I used the extinction which involved removing the triggers that cause unwanted behavior of me. And then I used increasing effort with shaping. Because rather than starting with a thought workout routine right away, I used a method called shaping, because this means gradually increasing the time and intensity of my exercise. Over the weeks, I built up my discipline. This approach worked because it allowed me to adjust my own pace and making it easier to stick with a habit in the long term. And also, I'm maintaining consistency over the 4 weeks is behavior change is consistency. I track everything, sleep, food, exercise routine over the 4 weeks. By regularly reviewing my progress and receiving feedback from my therapist, I was able to see patterns and make necessary adjustment. And also, was continuous monitoring helped me to changes I was aiming for. Alright, look at my graph. This graph is shown that my progress of my project. The first graph is I track my exercise duration and sleep pattern, and I increase my exercise time from 20 minutes in week 1 to 32 minutes in week 4, adding a few minutes each week. This gradual increase helped me to avoid a burnout and maintain a consistency. Similarly, my sleep improved from just 5 hours to a healthy 7 hours per night by a week 4. Better sleep played a crucial role in managing my stress and improving my overall mood and energy levels. Alright, the second graph is shown that emotional eating episodes per week. This graph is represent the number of emotional eating episodes that I had each week. I went from 5 episodes in a week 1 to just 1 by week 4. Using a mindfulness technique like a deep breathing and progressive muscle relaxation PMR helped me to manage my stress and control my eating habits. So this is my last graph, which means weight loss over the 4 weeks. As you can see from the last graph, I started at 18 kg and steadily lost weight each week, reaching 75 kg by end of the week 4. This 4 kg loss is within the target of 5 to 10% weight reduction, which is recommended to improve PCOS symptoms. So the simplify of the progress and final result of my project, in the first 4 weeks, I focused on monitoring my progress regularly. This including tracking my food intake, exercise and sleep. I used 3 main tools, which means a fitness tracker, a meal planner and mood tracker. This is helped me to stay consistent and accountable. Not only that, for the final outcome, first I successfully reduced my weight by 4 kg, starting from 80 kg and dropping to the 75 kg. And also I improved my exercise routine by adding a 12-minute workout to my daily schedule. My My sleep quality also improved. I went from having a irregular sleep to getting up to 7 hours of rest of every night. Lastly, I used a mindfulness techniques to help manage emotional eating, which allowed me to reduce it significantly. These results show how small and consistent changes that can lead to me to measurable the progress. I'm excited to explain personal reflections and learning. Throughout the journey, I realized that I was motivated by reinforcing my small success, which means every time I noticed progress, it pushed me to keep going. Also, I found that mindfulness, especially deep breathing and PMR techniques, really helped me to control my stress levels, which was a big factor in managing my emotional eating. And also, I have learning a patience. Not only that, I have also learned that changes doesn't happen the overnight. I had to practice a patience both with myself and with my process. These experiences helped me to build resilience and deal with my challenges more effectively. And the third one, I have dealing some challenges. For example, I faced was trying to cut down on screen time. While it didn't cause me to eat more, balancing social media interactions and my time was low, and I had to find ways to manage that better. And also, I have faced a developing self-control. As I practice a mindful eating and stress-reducing exercise, I notice I become more aware of my triggers for overeating. I started making a better decision during the stressful situations, replacing emotional eating with my healthier habits. And the fifth, I also learned about long-term habits. Like a key takeaway for me is that a reinforcement needs to be consistent if you want to long-lasting habits. Also, I'm a finding non-food rewards was a better motivation for me in the long run. And also, I have applying a lessons in the finally I have realized that the techniques I used for weight management like positive reinforcement and mindfulness can be applied to the other areas of life. These strategies can help me to improve not just only the physical health but also my physical personal growth as well as. In the conclusion, as a result, the 4-week intervention significantly improved my weight management and overall health, especially in managing PCOS symptoms. For example, I have really seeing my PCOS symptoms has been decreased because my menstrual cycle is not is inconsistent but it's decreased because the previous I got only menstrual cycle on 7 month once, 6 month once, but now it's 2 months once like that. It was be decreased. And also I hope using the behavior modification techniques like positive reinforcement and mindfulness is really helped me very well. And also I lost 75 kg and adopted healthier habits. Although challenges such as emotional eating remain, I plan to continue using a stress management strategies and non-food rewards to maintain my progress and reinforce positive behaviors for my success for a long time. And also, a major component of my success was the collaboration with my therapist. Together, we created a plan that was not a realistic but also personalized to address my challenges. We review my progress regularly. My therapist is made my adjustment when I needed and also set a clear and achievable goal. This teamwork was important in keeping me really motivated throughout the process. Thank you.